Did you know the color of your wound can tell you a lot about what's happening inside the wound bed? Some colors can actually be a sign of healing, while others may indicate infection, dead tissue, or poor circulation. Today, I'm going to break down the most common wound colors, what they mean, and when you should be concerned. Hi everyone, I'm Alyssa, a nurse who specializes in wound care, and on this channel we talk about wound care, dressing selection, infection management, and chronic wound healing. If you enjoy wound care content, make sure to subscribe to my channel. Let's start with one of the best colors you can see in a healing wound. Healthy red tissue. This is usually called granulation tissue. This is one sign that your body is actively trying to heal. Granulation tissue contains new blood vessels, collagen, and connective tissue. A healthy wound bed often looks moist, beefy red, slightly bumpy, or granular. This tissue is fragile though, so aggressive scrubbing or traumatic dressing removal can damage it. If the wound becomes a very dark red, bleeds easily, or develops raised tissue, this may indicate inflammation, trauma, or hypergranulation. Hypergranulation occurs when granulation tissue grows above the surface of the wound. This can sometimes happen from excess of moisture, friction, inflammation, or bacterial burden. One of the most common wound colors people worry about is yellow tissue. Yellow tissue is often called slough. Slough is usually made up of dead cells, inflammatory material, and bacterial wound debris. It can appear stringy, thick, wet, creamy, or even sticky. Slough can slow healing because it prevents healthy tissue from growing properly. In many cases, the wound may need to be cleansed, debrided, or have moisture balance correction. Not all yellow tissue means infection, but it should definitely be assessed carefully. Green drainage or green discoloration may suggest bacterial infection. One bacteria commonly associated with green drainage is Pseudomonas. Some wounds may also develop a sweet or unusual odor. This does not automatically mean severe infection, but it does mean the wound should be properly evaluated. Black tissue usually represents dead tissue. This is also called necrotic tissue or eschar. This tissue may develop due to poor circulation, pressure, severe tissue damage, or improper blood flow. Eschar can appear dry, leathery, thick, or hard. In some cases, stable dry eschar is actually left in place, especially on heels with poor blood supply. Removing unstable tissue without proper assessment can be harmful. When surrounding tissue becomes white, soft, or wrinkled, this is often called maceration. Maceration happens when the skin is exposed to moisture for too long. This can happen from excessive drainage, urine, sweat, or dressings that have been on for way too long. Macerated skin becomes fragile and breaks down very easily. Pale tissue may indicate poor circulation or reduced oxygen delivery to the wound. This can sometimes occur in arterial disease, severe swelling, or chronic inflammation. Wounds with poor blood flow often struggle to heal properly. Wound color can provide important clues about healing, infection, circulation, moisture balance, and tissue health. But it's important to remember you should never assess a wound based on color alone. You also need to look at drainage, odor, pain, swelling, temperature, wound size, and patient history. If you found this video helpful, make sure to subscribe for more wound care education. And comment below which wound care topic you would like to see me cover next. Head to thewoundconsultant.com for expert wound care consultations, practical guides, and educational books, your go-to resource for smarter wound healing.